Broken Heart by Elizabeth Hamilton. This is where my story starts, August 25th, 1992, when I married the love of my life at age 34. I was the little girl that played with my dolls as if they were my children. I was the neighborhood girl who babysat all the other children. I always knew that I wanted to have a family and several children, but didn't realize it would be so difficult or that I would be older when it happened. I thought it would be easy, but I was wrong. We were married 3 years when we decided we wanted to have a child. I immediately got pregnant. At a very early doctor's visit, I found out that it was an ectopic pregnancy, and I was immediately sent to surgery, thus ending the pregnancy. We were advised that due to the damage in the fallopian tube, it would be highly unlikely that we would be able to get pregnant naturally, but they wanted us to continue trying before we looked at other options. It was a very difficult time as I continued to not get pregnant and see my 2 stepdaughters get pregnant. After trying unsuccessfully for approximately 6 months, we were referred to the Center for Assisted Reproduction. We met with Dr. Duty, also known as Dr. Kathy, and a plan of action was developed. First, surgery was performed in May to repair the damaged fallopian tube. We started with intrauterine insemination with taking Clomid, the cheapest way to start to see if anything would work. We tried for several months, achieving 2 pregnancies, but only both ended in miscarriage. We took some time off and decided we would try one more time. And on February 29th, 1996, a new journey started. We were pregnant. It was a wonderful pregnancy with no problems. At 20 weeks, the sonogram technician was concerned that the baby boy was positioned wrong and he couldn't see all 4 chambers of his heart. He wasn't worried and said that we would check later. On November 25th, 1996, Charles Quentin Dwayne Hamilton was born at 1:32 in the afternoon at 7 pounds 12 ounces and in perfect health, or so we thought. I questioned the pediatrician about his purplish-colored hands. The doctor dismissed me, saying it was immature circulation. At his 2-month well baby check, the doctor said he had a functional heart murmur, but not to worry about it. I trusted the pediatrician that I'd chosen because my gynecologist obstetrician had recommended him. He was the pediatrician of her own children. At the baby's 4-month well checkup, the doctor wasn't in, so the nurse practitioner saw him. She listened for a long time and looked quite concerned, and then sent us to a partner clinic so a pediatrician could listen to him. He advised us to take him immediately to Cook Children's ER. My husband was out of town at the time, and we didn't have cell phones, and his pager wouldn't transmit all the way to Houston, so I had to change the message on our home phone answering machine saying we were on the way to Cook's. Obviously, he was quite alarmed when he received the message. We were in ER for quite a while that evening until we were finally admitted. We were only told they thought it was a respiratory infection, but they would know more in the morning after x-rays were examined. My husband arrived late in the evening, and I told him everything would be fine and sent him on home so at least one of us could get a good night's sleep. The next morning, the nurse showed up and told me we were going for testing. We were taken to a room on another floor, and inside was a machine that looked like a sonogram machine, but it was an echocardiogram. The tech was doing a sonogram of the baby's heart. I knew immediately that something was wrong. My mommy radar The next morning, we were taken to a room for further testing. We walked in and I saw what looked to be a sonogram machine, although it was called an echocardiogram. Basically, what it does is take a sonogram of the heart. I knew something was wrong, as there was absolutely no eye contact, no conversation with the technician until she dismissed herself to get the doctor. In the next minute, my life changed forever. I was alone with my son when the doctor walked in and proceeded to tell me that my son had a very complicated heart defect. My first words were, "Is it operable?" And he responded, "We don't know." The life I'd imagined for my son flashed before my eyes, along with the questions. Would he live? Would he walk, talk, sit up, go to college, graduate, have children of his own? All the things a mother expects for her children. There are no words or pictures that can begin to describe the depths of despair we were feeling at this time. We spent the rest of that Friday in a blur, meeting with doctors, explaining our son's heart defects. We were told that Quint had a very unusual combination of defects. His diagnosis was an unbalanced AV canal with a hypoplastic left ventricle and aorta. We spent the weekend on autopilot, worrying if our son would live or die, waiting for a meeting on Monday. On Monday, his case was presented to the entire heart team. They decided that the first step was to do a heart catheterization to measure the pressures in his lungs. The pressures in his lungs were high due to excessive blood flow. The heart catheterization was successful, and the heart team decided that Quint would have his first surgery on April 17, 1997. During that procedure, a band was placed around his pulmonary artery to restrict the excessive blood flow to his lungs. After that, we were then given 3 options of treatment for our son. Number 1, compassionate care. Take him home and do nothing, and he would die at a very early age. Number 2, transplant. It was not suggested that it was a very good choice due to the fact that not very many hearts are available for infant transplants. Or number 3, a staged surgery. We felt that the staged surgeries gave our son the best chance for survival. Surgery was then scheduled. Quentin did very well during the surgery and post-op. He was released 6 days later on many medications and doctor's visits several times a week, with strict instructions to gain weight. Quint's second surgery was scheduled for June 30th. It also went very well. Quint was home in 6 days. But he started getting fussy, and when he woke in the mornings he was very puffy. That never got better, and finally, after being home a few days, we rushed him back to the emergency room. He was immediately admitted to the ICU. The doctor on call was not very optimistic and was not even sure that Quentin would survive the night. Further testing revealed that he had developed a pleural effusion of chyle. A drain was inserted into his chest to drain the fluid, and once again the surgeons were called in. They believed that his bidirectional glen was so successful that his heart size had decreased the opening between his ventricles, and the blood was having a difficult time getting out of his heart. The surgeons and cardiologists met again and agreed that the only option was another immediate surgery. That procedure was called a Damas K. Stanzel. This required taking his pulmonary artery along with a homograft of donated tissue and attaching them to the ventricle and aorta, creating an outlet for blood. Quint was extremely weak going into the surgery and not in good shape. Surgery was scheduled for July 17, 1997. We were given a 30% survival rate. Prayers went out around the world, and at the hospital the next day, Quint came out of surgery on nitric oxide to decrease his pulmonary pressures. He remained on the ventilator for 14 days and became narcotic dependent due to pain and paralytic drugs. He had to go through methadone treatment. This is a photo of him following the 3rd surgery in the PICU. He was released from there on August 6th and was sent to the floor, being released home finally on August 13th. Quint's final surgery took place June 9, 1999. It was the completion Fontan. He came out of surgery extubated and pretty and pink. He developed a pleural effusion and some heart rhythm problems, but all of those were easily corrected and he was home in a record 10 days. His recovery was uneventful and very quick. The night we arrived home, he rode his little Tykes cozy coupe around the driveway in his pajamas. He was very happy to be home. This story has a happy ending, as you can see from the picture on the left to the picture on the right of the same boy. Quint just turned 16. He's had very few heart issues. He goes to the cardiologist once a year. He's at the forefront of children surviving surgery for his combination of defects and sets records every day. We're very fortunate to have lived in a community where these options were available for our son. Please remember that congenital heart defects affect 1 out of every 100 infants born.